Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi Spa. Welcome to Bellissimo Live. In this version, I want to discuss PRP, which is platelet-rich plasma. You may have already heard about this. We are just now introducing it to our practice to help us treat patients that are having acne scars, traumatic scars, and even some post-surgical scars that might be having some trouble healing. So PRP has been shown to decrease some of the inflammation that patients are having around the time of healing. Inflammation is important for all of us to heal, but when the healing process or the inflammatory process is a little bit too robust, we've been using things in the past such as injecting Kenalog, which is an anti-inflammatory steroid. That's been a mainstay. Also, microneedling has been shown to help, and microneedling with radiofrequency. But the addition of PRP has also been shown to be an additive to help control that inflammatory process so that scars may get back on track and soften and fade in a little bit more gentle fashion. So in our practice, we're going to be combining it with microneedling and also with microneedling with radiofrequency. And I'll discuss that more in just a few minutes. So basically, we get the PRP from the patient. We have a patient come in, we draw their blood into a special tube. That tube has a matrix that helps us separate out the red blood cells at the bottom and the serum at the top, which contains the platelet-rich plasma. We're able to aspirate that plasma and then applying it to the skin, and then afterwards we can do a microneedling treatment, and we can do that in multiple passes. When we use it with microneedling and radiofrequency, which we've been using for more aggressive scars such as acne scars, we would actually do the microneedling and radiofrequency first, as we normally do, and then apply the platelet-rich plasma on top of that. And those microneedling channels, whether it's with the radiofrequency or not, can help the PRP soak into the skin and help treat that inflammatory process. It's very comfortable. It's done under topical anesthesia. Whole process takes about maybe 40 to 45 minutes. We can repeat that as time goes on. We probably wouldn't want to do it until every 2 to 3 months. With the addition of the PRP, this may help us treat some more aggressive acne scars that might be a little bit more resistant to just microneedling alone. So we're very excited to have it. Post-treatment, we ask patients not to wash the area for about 12 hours. We like to have that PRP really soak into the tissue and not be washed away. We don't want patients exercising for about 24 hours, so not a lot of downtime with this. Be sure to have clean sheets and pillowcases for that first 24 hours as well. Now, patients will ask about when can they resume their normal skin care. So things like moisturizers, you can start after you wash after the first time after 12 hours. But if you have other skincare products, discuss that with your provider. Things like retin A and vitamin C, we want you to hold off on those for about 2 weeks or so. You can start using makeup right after you do the cleansing, so I would say about 12 hours after the application of the PRP. We'd like you to always use sunscreen, but you can resume sun exposure in about 48 hours. But again, sunscreen is very paramount. The key to sunscreen is you want to apply it 20 minutes before you have any sun exposure. It takes about 20 minutes for that barrier to be set by the sunscreen. So anytime after that, you can go out into the sun. Again, limit your sun exposure for approximately the next 2 weeks. So because we're going to be drawing your blood, and the amount of plasma or serum in your blood is really reflective of how hydrated you are, we like you to be very hydrated about 24 to 48 hours prior to your treatment. So try to avoid alcohol, coffee, tea, things that are natural diuretics that make you urinate. So we want you to stay hydrated, increase your water intake for that 24 to 48 hours prior. Well, I hope this helps. We're excited about adding PRP to our practice. If you have any questions, feel free to call us, visit our website, and follow us on social media.